So now we're going to talk a bit about the complications for mother and baby of preeclampsia. So one of the best known ones is HELP syndrome, and that stands for hemolysis, elevated liver enzymes, and low platelets. So to talk about the first component, hemolysis. So this is to do with the procoagulant nature of endothelial inflammation, which we talked about before. So those microparticles of placenta distribute throughout the endothelium of various vessels and they inflame it, which makes coagulation more likely. And that means that in lots of small vessels, you get platelet aggregation and fibrin meshes forming. And then when blood is passed through those fibrin meshes, the red blood cells get sheared. And that's how you get MAHA, or microangiopathic hemolytic anemia. On to the next part, elevated LFTs. So the same microthrombi we talked about for MAHA can form in and around the liver, and that causes congestion within the liver, which means it doesn't work as well. And that in combination with some of the placental factors, particularly placental Fas ligand, which is hepatotoxic, these two things together cause inflammation and damage of the liver, and so it releases enzymes into the circulation, and that's why those will be elevated. And finally, low platelets. And this is to do with the two things we talked about before. It's because when these microthrombi are made, platelets are consumed in making them, so the number of free platelets in the serum will decrease. Now, it's worth mentioning that although all three of these are key features of this disease, it's difficult to diagnose it based purely off of the anemia or the low platelets, because both of these are normal findings within pregnancy. And for the LFTs, ALP is not a particularly useful marker because, again, elevated ALP is a normal finding in pregnancy because it's made by the placenta. So elevated ALT and AST are frequently some of the most useful measures for detecting HELP syndrome. And if there are previous blood tests to compare it to, then that is makes it a lot easier to distinguish whether this is a new anemia and a new thrombocytopenia, or whether this is just a gestational variant that's actually very normal. So perhaps the best known complication of preeclampsia is Fulloneclampsia, which is just defined as seizures in a woman with preeclampsia. The mechanism of why this happens isn't completely known, but there's a lot of suspicion, and it's generally accepted that this is due to cerebral arterial vasospasm, and that there may be edema in the brain as well that contributes to it. We treat this by giving IV magnesium. It's also used as a preventative measure, and this is given because it vasodilates the cerebral arteries, which gives a lot more support to the theory that it's due to vasospasm of them. You can also get coagulation abnormalities, as we've talked about. They're an important part of HELP syndrome. These can progress towards full-on DIC. This is less of a problem in this country, but is a big problem in the developing world and a major cause of maternal and fetal mortality. And you can also get clots causing organ dysfunction, as we talked about a little bit with the liver. Okay, so these are some of the more severe manifestations of preeclampsia, but they can occur. So we talked about how proteinuria occurs because the endothelial damage means that the kidney vessels become leaky. And if that happens enough, then you will eventually develop renal failure. We talked about how if vessels become leaky, you can get edema into various places. That includes the lungs. And finally, cerebral hemorrhage can occur because you have a combination of vasospasm, so you have high arterial pressure, and endothelial damage. So the vessel wall is weakened, and that can cause cerebral arteries to hemorrhage. And it's important not to forget the fetal complications of preeclampsia. It's a major cause of intrauterine growth restriction and all of the morbidity and increased mortality that comes with that. And it also tends to cause preterm delivery. Now, these two factors don't seem like a lot on their own, but in combination, this means that preeclampsia is actually responsible for increased incidence of a wide range of problems, especially in the neonatal period, because babies are born early and their tissues are immature, so they can't cope with extrauterine life, and they have all the ramifications later on in life of being born preterm and being born at a low weight.